I'm Robin Morrison, and today we'd like to welcome Linda Harvey to the Patient Prism studio. Thank you for coming today.
Thank you for having me, Robin.
Of course. Linda is a nationally known and recognized healthcare risk management compliance expert who assists dentists and their teams as they navigate the regulatory requirements. She's the founder and president of 2 compliance-related companies. Linda's career in dentistry began as a dental hygienist, and since that time, she was recognized as a distinguished fellow in the American Society of Healthcare Risk Management. During her programs, Linda draws from real-world experience, having worked with offices that have undergone HIPAA, OSHA, and infection control audits. So Linda, I'd like to ask you a few questions to learn a little bit about you and how you got in this business. So compliance and risk management is such a specialized niche. Tell us a little bit about how you got into this.
Well, I'd have to say the path probably found me versus me choosing the path. When it occurred, I was looking to do something different outside the realm of the 4 walls of a dental hygiene operatory. And a good nursing friend of mine said, you should look into risk management. And my answer was, risk what? And since then, it's just been a perfect fit. The compliance, the risk management, the patient safety have just been a natural passion for me. So I really love what I do.
That's amazing. It's so nice to do what you love.
It's amazing, yes, it is.
And goodness knows we need specialists like you in our industry for sure, as fast as everything changes and to keep up. So
It's ever changing.
So I've seen quite a bit of dental news stories and posts about different kinds of breaches, ranging from infection control to Medicaid audits. What do you think is going on? It's a little concerning.
You're right. Every time you turn around, you see something in the news. It's a dental office where there's been a whistleblower complaint, or the state has come in and closed down a dental practice, or a patient's complaint, or unsterilized instruments being used. I think one of the reasons that it's coming to our attention so more prominently is the fact that with media, social media, news stories, we have the ability to get the word out there, as you might say, in an easier fashion. Also, there's an awareness happening in our environment, in our communities, nationally and locally, for what should be done. Where it's infection control or compliance with audits and just about doing the right thing. So I think as that awareness has come up from what's happened in the medical world and seeing news stories there, it's just bringing an awareness to dentistry. So I think that's what's triggering a lot of stories that we're seeing.
Oh, well, that makes perfect sense, really. So tell us, what's the most unusual dental HIPAA story that you've read about, or you know about, or you've experienced?
Well, I'm going to tell you about one that I experienced, and I'm going to make an analogy here to the movies. And with a lot of movies, there's a prequel. There was a prequel with Planet of the Apes and Star Wars and Star Trek. So this story with this client, as they came on board, there was a prequel that we had no knowledge of. We came into the story with a practice that wanted to be compliant in both OSHA and HIPAA. And as we were gathering information to customize their policies and procedures, they told us that they had professionally shredded all their dental records and they were totally electronic. And that sounded great. Many of our clients are doing that, right? So we're gone with the paper days and we're moving into this streamlined, technology world. Well, after we finished our project, no more than just a day or 2 later, they got a call from the Office of Civil Rights. As it turned out, before they engaged us, they had taken all those boxes of patient records and put them in a dumpster.
Oh my goodness.
And so somewhere along the way, someone took a picture, filed an anonymous complaint, and they underwent a 9-month investigation. So the aha for me was, always go back a little further with the questions. Don't just take first value. I think that was a rare situation. It's not come up again with any other clients. Most offices are always eager to share things with you so they can do it right, and you can better help them to do it the best way for their practice. But that was an interesting story.
So go back a little further.
Yes, go back a little further.
Yeah. I bet you've got a lot of stories.
Yes.
I bet you could tell them over and over and over. So, well, where do you think dentistry is missing the boat with HIPAA?
Robin, I think that one of the ways that we're missing the boat is that the dentists don't think it's going to happen to them. We haven't really come full circle with, I don't know if embracing is the right word, but embracing the fact that compliance needs to be part of the budget. Compliance with your IT company and having a good vendor that can safeguard your information on the back end, and compliance from having those customized policies and procedures. So I think they're missing some of that piece. But it's growing. I think we're slowly moving to a better direction.
Yeah, creating more awareness about it and
Absolutely.
finding ways to do that. so they understand the importance.
Yes. And the consequences of not being compliant.
That's what we talk about, the consequences,
Oh my gosh, the HIPAA fines can be as much as $1.5 million.
which would devastate a practice.
And the fines are applicable even if you go out of business. And there's been several situations where that's happened in the medical world.
Oh, so
So you-
say they sold their practice
And you
or
go out of business or
anything?
you close your practice, it doesn't absolve you from the fines. No. So I think that, coupled with the reputational risk, even if the fine is much less, you have the issues that you have to combat from reputational risk alone in a community. If you have to notify several thousand patients that you've had a breach or potential breach, the trust is not there.
No, definitely not. Wow. Okay. So I have one more question for you.
Okay.
So what other trends do you think we should be keeping an eye on in dentistry?
Well, there's three things that I see that are happening. One is these compliance trends are going to continue when it comes to having customized policies and procedures. We definitely have to have that in all these areas. One trend is regarding medical marijuana. That, as we see in the news, has been legalized both either for medicinal purposes or recreational purposes in a growing number of states. So that brings us around to what's going on with your employees, making sure they're safe on the job, and your patients, getting good health histories and asking those questions to be sure that they are safe in your chair, because so many general dental practices now are providing some level of sedation.
Right.
So that goes hand in hand with patient safety.
Wow.
And then there's a third trend, which you might use the term retail dentistry. Retail medicine has been around for a while. We know that we can go to different convenient locations on the corner sometimes in your community, and there's a doctor's office or a nurse practitioner within a pharmacy or another group, and that is now coming to dentistry as well, bringing neighborhood dentistry back in a different format. So some interesting trends to follow for sure.
Yeah, dentistry is changing so rapidly. It's fascinating, but we have to keep up.
It's fascinating, yes. There's all kinds of interesting relationships and growth and keeping up with that, because all these new interesting trends and ideas bring new possibilities, and hopefully in the long run the goal is, as we know, to bring better quality of care and increase accessibility for patients. But on the back end, we have to be sure what are the risks that we might be missing or not aware of.
Right, that makes perfect sense, yeah. Well, thank you for joining us
Thank you for
today.
having me.
This
It's
has
been a
been
pleasure.
fantastic information.
Thank you.